children there at that school-based health center. One of the great advantages to a school-based health center is that I should go back, and it's really not to be confused with school nursing. A school-based health center is, we can diagnose and we treat the patients just like we would at our regular clinic, which is entirely different from school nursing, which is, and you know, so much of that, so many cuts have been, sadly, have had to be taken recently in the school districts with the school nurses. So we treat and diagnose our patients in the school-based health center.
So for instance, if somebody was feeling feverish or perhaps had an injury or something, they could come there and and see the physician or nurse practitioner provider on duty.
Right.
I see.
And one of the real huge benefits with having a school-based health center and bringing the services on the campus to the students is that research has repeatedly shown that the students are 2/3 more likely to go and try to access the health care.
I see.
There's the issues of transportation, with their possibly their parents having to take time off from work to transport them off campus, gets rid of all of those barriers. And so what happens is children are healthier, they stay in school, they miss less classes. It's
all positive.
It's all positive, yeah.
So does the sliding fee scale also apply there, or is that a different?
Well, actually, we never turn anyone away anyway because of the inability to pay. But we do not charge
the students.
Right.
I see. That's so awesome. You talked a little bit about the fundraising. I understand that you just recently had your annual fashion show. How did that go?
It went fantastic. We had a huge turnout, filled the room, and
where was that at?
It was at the Mill Casino. It was just a couple weeks ago, week and a half ago. We did it was great. It was a great turnout. Great,
and that's one of your major fundraising endeavors. Do you have others?
Well, in the past we've done others. We don't really have anything coming up in the near future. We've kind of settled into the once yearly major fundraiser. We do have something exciting coming up in the fall, though, and it's one of the first times that we've branched off in this direction, and working with one of the Rotary clubs in the area, and we'll be putting on a women's conference. And that's scheduled to happen, I believe, November 7th, that first weekend in November.
I see. And you'll bring in guest speakers.
Yes.
And it'll be held here locally.
Yes.
And good fundraising endeavor for the clinic and good for the community.
Oh, a fundraiser, but what we're really looking to do with this is also provide an educational and a bringing together of our community again, really focusing on the family and what we can do, how we can help folks, you know, with those family relationships and those structures and such.
That sounds like a vision. Do you have any other visions for the future? Where do you see the Waterfall Community Health Center in, let's say, 5 years from now?
Well, that's an interesting question, because if you'd asked me 5 years ago where we'd be today, I don't know that I would have had precisely the vision that where we are today. I do know that there is so much need out there, and I imagine that hopefully we'll be twice as big or 3 times as big as we are now. You know, it would be better, of course, if the need wasn't there, but we need to meet that need, and So I anticipate that we will continue to grow, and we'd like to expand our services.
Expand in what ways?
Well, continue to expand in the dental field. That's a huge need in our county, oral health care, and continue to expand in the area of mental health care. That's also another very large need.
I see. Why don't you tell our viewers exactly where you're located and the hours that you're in operation, and what people in the community can do to get involved on a volunteer basis or perhaps make donations to the clinic.
Okay. Well, we're located at 1890 Waite Street. That's where one of our main site is, in North Bend. And it's sort of in behind the Bay Eye Clinic off of Broadway in North Bend. And our hours are we're basically open from 8:30 to 5, 4 days a week. And on Wednesdays, we're open from 8:30 to 8 in the evening. And additionally, we'd like to expand our evening hours as we bring on more providers and can do that. We'd like to be able to provide access for folks after their working hours, so we hope to increase that. Our phone number, 756-6232. Our other site, like I said, was our school-based health center site is in the Harding building of Marshall High School in Coos Bay. And there's all kinds of ways that you can volunteer. If a person's a professional, a physician or a nurse or anything like that, we have ways that we could use their services. And we have, folks could just call the number and we'd be happy to get back to them. We are always interested in folks that might be willing to help us put together our fundraiser. It takes a lot of work and it's a lot of fun, but you know, many hands make light work, or whatever the saying is. And
okay, well, great. I want to thank you, Kathy, for coming on Community Chest and explaining the Waterfall Community Health Center and the services and the tremendous value and benefit it brings to our community. And I personally thank you for all your hard work and in your endeavors. This is all the time that we have today for Community Chest. I'm Felix Milan, and I will see you again in the near future. I thank you. Be well.